My name is Reuben. I'm a plastic and reconstructive surgeon. I work for Intermountain Healthcare at the Avenues Specialty Clinic. I chose plastic surgery because of the diversity of the field. It's one of the few fields in medicine where we get to work with all the various specialties from urology, OB-GYN, general surgery, neurosurgery, internal medicine, and we help these different specialties in different ways with complex problems. No two problems are alike. They're all very different, and that creates a lot of challenges in the field and so much variety that it really keeps things interesting. So every day is different. No two patients are alike, and it really makes it a very interesting and rewarding field. Probably the most rewarding part about being a plastic surgeon is helping people that are really in need. So we get called in for very difficult reconstructive problems. So when a neurosurgeon has exposed bone on the scalp, or when a urologist has a difficult reconstructive issue, we get called in to move tissue around and to help close things. We're often called the finishers in the surgical field because we help so many various specialties close complex wounds, complex issues that they have. Some really rewarding and memorable experiences are helping out with some of these really tough problems. So people think of plastic surgeons often as cosmetic surgeons, and while we do a lot of that, we also deal with a lot of the reconstructive things. My areas of focus in my practice are really twofold. One is in what's called body contour, and specifically after weight loss. So they achieve their weight loss goal, but then they feel trapped in their body once again because they have all this excess hanging skin. So what we do is we go in and we really contour and just absolutely reshape their bodies. The abdomen, the back, the butt, the thighs, the arms, the breast, and recontouring patients so they can actually get their life back. So they can exercise again and actually feel good about who they are, not just because of the weight loss, but because they enjoy having the body that they dreamt about. The second focus is in breast reconstruction. And so I'm one of a few surgeons in Salt Lake City that offers the full spectrum of reconstructive plastic surgery, where we offer free tissue transfer from the belly or the buttock to recreate the breast, in addition to expanders and implants. So there's more than one option out there, using your own tissue or using expanders and implants for breast reconstruction. A memorable experience for me goes back to helping with reconstructive problems. So we had a tough patient that had bad scar tissue, ended up having exposure of a lot of plates and some bones in his face, and so we were finally called in years down the road, and we're able to bring new soft tissue up, bring some tissue from his leg up to cover his face and to reconstruct part of the bone to give him a much better appearance, and so he wasn't walking around with bone and plates exposed and whatnot. And it really just absolutely changed his life, just changed the quality of his life, changed the interactions. So you think about what's the first thing you do when you look at someone? You look at their face. And so it's just such an important part of who you are, how you're defined, and for you to be defined in a disfigured way is really, it can be very challenging for someone to live like that on a daily basis. So this patient was just absolutely just ecstatic and so happy that his life was just completely changed by his reconstruction.